I'm Dr. Eva here. I'm going to start the topic of acute respiratory distress syndrome. This is an acute disease, so it is the respiratory failure occurring within the weeks. It's characterized by the rapid onset of respiratory insufficiency, cyanosis, hypoxemia, which is arterial in nature. And then there's a diffuse alveolar damage occurring in this disease. So we are going to start its pathogenesis. In pathogenesis, there's due to some insults capillary wall damage, so compromise in the alveolar capillary membrane permeability occur. When there's a damage of capillaries, then interleukin 8, interleukin 1 and TNF play its role. This causes a neutrophilic infiltrate to enter into the alveolar. So when neutrophils infiltrate into the alveoli, it causes damage to the endothelium. When there is damage to the endothelium, then vascular leakage occurs and edema occurs. Due to the vascular leakage and edema, decrease in lung surfactant occur. Okay, what neutrophil causes? It releases two types of oxidants. One, there's reactive oxygen species, and then there's proteases. These proteases causes damage to the proteins. When there's damage to proteins occur. Protein damage causes damage to the endothelium, and due to damage to endothelium, there is vascular leakage causing edema. So imbalance between the protective and defensive mechanisms occur, which causes diffuse alveolar damage. So we go to its morphology. First of all, morphology, we are going to start with gross picture. In gross picture, there's lung or red, firm, airless and boggy appearance of lung occur. Okay, then macroscopic picture, when there's capillary damage, it causes capillary congestion, alveolar capillary cell necrosis, intraalveolar edema. As there's vascular leakage occurring before we discussed, then it causes intraalveolar edema, hemorrhage, and then neutrophilic infiltrate are going within the capillaries, from the capillaries within the alveolar membranes, and then there's hyaline membranes in the alveolar ducts. These hyaline membranes contain edema fluid and necrotic epithelial cells. Then there's organizing stage, then where type 2 pneumocytes regenerates the alveolar epithelial cells. Then there is intraalveolar fibrosis occur due to fibrin-rich exudate and thickening of the capillary alveolar septa due to proliferation of interstitial cells and collagen deposition.